Another way you can protect yourself from disease is by knowing the risk factors or predisposing factors. For example, smoking, alcohol drinking, sedentary lifestyle, eating of junk foods, and other environmental factors may put you at a risk of certain diseases. So knowing these predisposing factors or risk factors will help you avoid them so that you are not put on the risk of developing disease. Take in the case of smoking. Smoking can put you at a risk of cancer. And also when many conditions are mentioned, smoking won't lack among the risk factors, and also is one of the key complicators of many conditions in the body. You are at a risk of diabetes. You will know that if I engage in sedentary lifestyle or in factors that may make me obese, they will increase the chances of me developing diabetes, especially diabetes type 2. Living in a house that has lead paint may put your children at a risk of lead poisoning. Also, working in an environment that has lead fumes may put you at a risk of lead poisoning, especially if you inhale them. In children, mostly lead poisoning occurs due to ingestion, and in adults, lead poisoning may occur mostly due to inhalation. Binge eating, binge drinking, or eating of junk foods may put you at a risk of obesity. And obesity, can cause inflammation in the body, may lead to insulin resistance, and this may put you at a risk of diabetes, especially diabetes type 2. Over drinking or abuse of alcohol may put you at a risk of liver diseases, for example, liver cirrhosis. Also, abuse of certain drugs, for example, steroids, may lower your immune system or may be primary to certain degenerative conditions or inflammatory conditions. Also, living in unsanitary conditions or environment may put you at a risk of certain diseases, for example, waterborne diseases, foodborne diseases. Like the other time I talked about how or the importance of ensuring that you wash your hands frequently. The least estimated amount of time is 20 seconds by the CDC. Also, normalize washing your dishcloths in your houses, proper handling of food, shopping wisely, proper storage. Sanitation is also important, especially during this time of pandemic. As I said earlier, you should ensure that you wash your hands frequently with soap and water. The least estimated time, 20 seconds by the CDC. This is important because it will reduce the risk at which you may contract COVID-19. Not only COVID-19, also influenza, and also common cold, without forgetting Ebola. Protect yourself from insects, especially mosquitoes. If you see an area around your house that has a thick bush or thick grass, ensure that you clear. Drain stagnant water. Ensure that you sleep under a treated mosquito net. You can also use mosquito coils. Limit the number at which you stay with your pets. These pets, they are good, they give us company. People love their pets, but they can put you at a risk of certain diseases and illnesses. Some people may opt keeping these pets outside the house. For example, if it's a dog, you can build a kennel for it outside. And maybe sometimes when you're free, you can take it for a walk. How do you reduce your risk of infection during a pandemic? 2019-2020, we have seen coronavirus spreading rapidly throughout the world, making headlines. Government organizations, healthcare agencies have been working so hard to flatten the curve or to reduce the risk of infection. People are aware of how this disease spread and transmit, so they should strive to avoid unsafe practices. We have seen in buildings, guards standing with the infrared thermometers trying to check your temperatures. We are warned to avoid unnecessary physical contact, for example, unnecessary hugging, unnecessary greetings. Observing hygiene, as I mentioned earlier, washing your hands frequently, wearing your mask, and also observing social distancing when in public places. Strive to continue adhering to these guidelines put about by these agencies. There is a common adage that goes like this: prevention is better than cure. Although we cannot completely protect ourselves from disease or protect yourself from getting sick, but at the same time, we should be cautious so that we do not become victims of disease. Also, the other time I was encouraging people to know their blood group, to know or to do genetic testing before deciding to have children. Also know your HIV status so that you don't put others at risk. Knowing the risk factors and predisposing factors is very important to help you protect yourself from disease. There are many that I would have mentioned, but I just wanted to put across this message that we should know the predisposing factors to disease.